Hi, I'm Shelton Goode, and this is The Executive, a C-suite conversation. Kathy is the Chief Executive Officer, and she leads the organization's diversity and inclusion and equity strategy. What you're going to hear out there is not a diversity practitioner, but a C-suite executive who is just as comfortable, confident, and competent leading her organization's diversity, inclusion, and equity strategy, not only internally, but for the community that her organization serves. So, Kathy, when we're talking about diversity, inclusion, and now there's this new concept. It's not new, but it's found its way into the language, which is equity.
Yes.
I think when I talk to professionals, we have gotten the feeling that we're sort of the preachers talking to the choir.
Yeah.
So I think that a lot of people would like to hear from an executive, someone that is responsible for running a large organization. Right. Why is diversity, inclusion, and particularly in your case, running a healthcare organization, equity? Why are these things even important? But before we talk about it from the organization standpoint, I think people would like to know, why is it personally important to you?
Sure. I've been in healthcare for over 30 years. And I remember in my career and in my experience, seeing decisions being made by groups of people who were not diverse. And seeing and being maybe at least the minority in the room, being the only female in the room, I could at least have the perspective that I could recognize that those were not good decisions, or at least not the best decisions that were being made, because it was made from a perspective that wasn't informed, by a broader group of people, whether it was related to the community, whether it was related to patient services, whether it was related to leadership. And I literally could see that that was the less optimal decision for the organization. And when you start to reflect that, then you really understand that diversity and inclusion, and now as we measure more and more equity, isn't just a good thing to do, it's a business thing to do, because you're really not leveraging the power of a diverse set of opinions to improve your organization.
Right.
And once you have that personal revelation, I think that it's almost like a revelation coming over you. Wow, this is what they mean, and to really grasp it then, and then you internalize it and say, now I get it, in a different way. And I had that experience several times over my career of just being able to witness that decision-making process and knowing that it was less informed, than it should be. And that's probably when it became real for me.
Right. That's when it became real for you.
Right.
So talk to me about the organization.
Yeah.
A diverse organization. I mean that in every way possible, particularly in terms of mission. You've got the multiple layers. You've got patients. You've got providers.
Right.
You've got stakeholders. You've got so many people. So I'm talking about D from the biggest sense. But why is it important? How does it help your organization be better? I think people always want to know, well, where's the proof in the pudding?
Right, exactly. It's imperative for us. We are a community organization. It's embedded in our mission statement for the communities we serve. So it's just a mandate, that we serve our communities. But I think what we've gotten smarter about is how we serve our communities. So again, back to that diversity of thought, that diversity of inclusion, how can I serve my communities if I don't have all the perspectives of the patients that we're taking care of?
Right.
We're not going to know how to take care of our patients in the best way unless we're addressing where they come from, what their cultural background is, what their experiences have been, whether it's their age, whether it's their gender, whether it's their socioeconomic environment. How are we going to serve them if we don't know how that influences how they approach patient care? So we can't be the best in quality, which is what is in our vision statement we aspire to, unless we understand those things. So it's absolutely imperative to our organization to serve our communities. And then when you talk about our employees, our staff, our providers, our stakeholders, how do we take care of people when we are taking care of them at the most vulnerable time in their entire lives? if
Mhm.
they don't feel comfortable in that environment. And we
Mhm.
all know that people feel comfortable
Mhm.
when they see people who are like them.
Mhm.
And so we have to reflect our community in terms of the folks who work with us. And that
Mhm.
may just be seeing somebody passing in the hall. That means maybe making sure that we have providers
Right.
who are of a diverse background, making
Right.
sure that we have nurses who are of a diverse background, that they reflect our community. And then if we can't touch on every aspect, because our community here in Milwaukee is an urban community, is very, very diverse, making sure that our staff are at least conscious
Right.
of how people come to healthcare in a different way based on those experiences and their background and their culture, their language,
Right.
all of those different types of things. So for our organization, because of who we are, what we have found is we can't meet our aspirations and our vision and meeting our mission of serving our communities unless we reflect the communities we serve, both in terms of listening and understanding the patients, but also reflecting that for the people who work with us day in and day out.
Right. So help me with this. Is that what? Well, let me just ask the question. What is equity in healthcare? What is this?
Sure.
Because it's a big push.
Yep.
I don't want to call it new, but it's just popped up on my radar, and I'm still trying to wrap my head around what exactly is equity in healthcare.
Sure. So, when we think about diversity and inclusion, it's all the things I just talked about,
Right. Right.
making sure the people reflect your community, you're listening. But equity is something that you can measure. And I think the reason that it's relatively new in healthcare from at least a healthcare outcomes perspective is we're relatively new to measuring our quality and our outcomes because we have better data now.
Okay.
So equity in healthcare is about making sure that regardless of your background, regardless of your age, regardless of where you come from, if you have the same disease, you should have the same level of success of being cured by that disease. That's what we mean by outcomes. And
Okay.
that's what we mean by equity and outcomes.
Okay.
But what we find out is that's an enormously complex equation because you can't just say this person had a heart attack and this person had a heart attack.
Right.
You have to understand, was this person come in with other diseases?
Right.
Compared to this person, that's a
Right.
risk adjuster.
Right.
We find now that I think the estimates are over 70 to 80% of your health is actually influenced by things outside of your healthcare system. So it's your environment, your
Right.
socioeconomic background.
Okay.
What's this person, where do they live? What's their environment? Are they working? Do they have adequate access to food? Those types of things compared to this person. That's a real risk adjuster now that we look at in terms of equity. And you have to understand that because you're going to treat the person differently in your care plan to get the same outcome.
Right.
So what we have to understand is all the factors that go into that to ensure that this person's of success of surviving a heart attack and getting back to a functional status is the same as this one. But by understanding those differences that they come to you with, that will help you treat and get that outcome the same way. So we are actually now actively cutting our data. We might look at our success rate in terms of people recovering from a heart attack, and now we cut it by age, gender, racial background, socioeconomic background. We're starting to do cuts on that because we know it makes a difference in terms of our care plan and other types of things to make sure that regardless of all these other factors, we're as successful with population A as we are with population B.
Got it. At least I think I do. Let me try a quick anecdote. I'll use myself.
Sure.
And then we can see if we're the two meet
Right.
or if they do. Because this is how I've always visualized equity in healthcare, at least this is how I internalize it. So I'm an Air Force vet, so I have good healthcare insurance.
Yep.
I'm in Atlanta, Georgia.
Yes.
A major metropolitan area, so I've got good access to healthcare. So I went in for a annual physical.
Right.
And now I want to talk about that in a second because as an African American male, the first thing people are like, "You went in for a physical?"
Yeah.
Well, my wife.
Any male.
Yeah,
Let's start there.
Yeah. My wife made sure that I went in for
exactly.
my annual physical, and they caught a tumor early.
Sure. Okay.
But even my doctor, who was an African American doctor, said, "Do you understand?" He says, "Why am I talking to you?" Then he turned immediately to my wife and says, "Make sure he goes for a colonoscopy.
That's right.
So we can find out what's going on, and then make sure that he goes to see the oncologist or whatever."
Right.
But he turned right to my wife because he understood you know what? As a male,
That's right.
particularly an African American male,
Right.
I diagnose people with situations all the time, and they
Right.
don't follow up on
That's
it.
right.
So him being aware of everything that I
Absolutely.
brought, good cover, good
Right.
healthcare insurance, good access to
Right.
oncologists and surgeons, but wanted to make sure that my behavior,
Right.
that I heard him.
Absolutely.
And then what did he do? He talked to my wife. And I remember talking to my wife saying, well, wow, I wonder how he would have handled that if I was Hispanic or if I was Muslim
Absolutely.
or whatever. She says, well, you're the diversity guy. Isn't that what equity is
Right.
about? Well, I don't know. So the question is that
It's
what equity is
absolutely
about?
it's absolutely what we're talking about. So let's even peel it back further. Let's say maybe they don't have access to healthcare.
Right.
Maybe they don't have good insurance and find it hard to find an appointment.
Right.
So, for example, we will see patients. We know that there's scientific data and outcomes
Right.
that say that African American women die more often from breast cancer than white women do.
Right.
It's a fact. Now, let's kind of peel that back as to why. Is there an access problem? Sometimes yes, sometimes no.
Okay.
Is there a screening problem? Sometimes yes, sometimes no. How do we then work with the community to make sure screening comes off that checklist?
Right.
Because we can help provide that in the communities that don't have access to that. How do we make sure there's follow-up and all of those other kind of things? So there's even those aspects. But yes, in terms of how people approach healthcare because of their cultural background, we know that in certain cultures, it is disrespectful to talk to the younger person who may be interpreting
Right.
for their parents.
Right.
And that maybe that younger person might have a different point of view than their elder does and isn't telling us what their parent is actually wishing.
Yes.
We know that because we have spent time in unconscious bias in terms of the different cultures and how they approach healthcare.
Got it.
So how do we bring in our own interpreter
Right.
who might speak that language also and
Got
not
it.
rely
Got
on
it.
the son, the daughter,
Got it.
and make sure that the wishes are respected, because only when wishes are respected are people
Right.
really going to follow up and do
Right.
their care.
Right.
It's that nuanced in terms of understanding equity.
Yes.
And we're just starting in healthcare
Yes.
to peel all of that apart. So
Yes.
today, we know that there might be a disparity in the ultimate outcome. Did they get better?
Yes.
Did they get cancer and did they get better?
Yes.
Did we find it fast enough? But then we have to peel back all these other factors behind it
Right.
to say, how do we make sure that regardless of that,
Right.
they had the same outcome?
Right.
And you're going to just go at that path a different way. Sometimes there are complete medical differences. We know that women present differently than men
Right.
when it comes to certain diseases, particularly heart disease. Making sure our physicians are aware of that. And that's a clinical distinction even before you get into all the other cultural and other socioeconomic things and things
Right.
that can have influence. Right.
I think the audience would appreciate that, because now we're talking about specifics. We're talking
Yes.
about outcomes. We're talking about things that can be measured.
Yes.
And more often than not, when people that do what I do, we're talking all these abstract terms.
Right.
It's like, well, what's engagement? What's
Right.
this? Now we're talking what my grandmama used to say, brass tacks.
Absolutely.
I think what the
Absolutely.
audience would also appreciate is you talked about the community.
Yes.
So why don't we open it up? What are the things you're most proud of?
Yeah.
Either internally or in the Milwaukee metro community.
Sure. I've been at Friedrich for almost 10 years now, and I got here literally probably within 6 months of our start down a deliberate path on diversity and inclusion at the time. And we went to the community and we asked, so different stakeholder groups, whether they were African American, whether they were Latino, whether they were LGBTQ, what do you think? How do you think we're doing? How do you think that we show up in the community? What's your impression of our urban hospital, and all of those different types of things? Got anecdotes, but focus groups. So we got real feedback on that.
Okay.
We also looked at data, the brass tacks, what are our patients telling us in our statistically relevant patient experience surveys? And what are they saying? What are the comments? And they pointed out a couple of different things for us, not seen as welcoming, not seen as inclusive, not in the community. Yeah, Friedrich wrote checks, but you didn't show up.
Okay.
You weren't there.
Okay.
So it really gave us some very good feedback that we're kind of blind to, that said we need to do a better job, in terms of reflecting our community, listening to our community, being in and present in our community. And I think what I'm the most proud of is that we show up in a different way now.
Okay.
So yes, we do look for partners in the community that we can invest in and the money matters,
Mm-hmm.
but we are actually on the board of those clinics
Okay.
where we make an investment because we want to be present. It's not just writing a check and walking away.
Got it.
We want to make sure that it's going to make an impact and that it's going to be done with the same values that we do. We show up with presence in different areas. We're very deliberate about what community partners that we work with because we are putting our time and talent behind that when we do that, and we show up when we do that.
Got it.
And I am hearing that more and more. And in fact, actually, we've been recognized as one of the best community health partners in our region. We have been recognized in the LGBTQ community as one of the best partners in the region. And so it's one thing to say we're very proud of what we do, but to be recognized for it means our community means that they actually see what we're doing. And so that's probably the area that I'm the most proud of. Internally, we measure. Does our employment match our community? Not quite. Still not quite. We've made a lot of big gains. But then that it doesn't, then what are we going to do about it? And then you measure the gains that you make over time. Does our leadership? No. Okay, great. What are we going to do about it? Does our board? No. What are we going to do about it? So you measure things and then you hold yourself accountable to be able to get those results.
Year over year change? Obviously can't be quarter over quarter. So when you're looking for change, over what time period would you expect to see some change?
We actually look at employment quarter to quarter because employment's a pretty dynamic thing in terms of turnover rates, vacancy rates, hire rates, retention rates, promotion rates, all those different types of things. At the leadership level, yes, it's probably more annual because those positions just don't turn over that much.
Right.
But yeah, minimally, we look at it on an annual level.
Anything keeping you up at night?
Anything.
Right.
You're running, keeps me up at night.
Running a medical
exactly.
college and a medical organization. Yeah,
exactly.
Right.
Probably the single biggest thing that keeps me up at night is our people, because we can't serve patients without people.
Right.
And when I say that, it's everything from enough people. We're in a very tight job market. People have choices, in terms of their jobs. Right people. Again, this gets back to people who are mission aligned with us and we believe are best to interact with our patients, but reflect our community. How do we put all of that together? The resources that we put into our people to make sure that they feel engaged, can develop, can grow at Freighter. Those types of things, making sure we can get those resources when we might not always be getting paid for those resources. So I think the whole thing evolving around our people and making sure that we can really strive to achieve that vision of excellence and that mission of serving the community. If I wrap all of that up, it's really about our people.
So let's wrap up by having you issue a challenge to your fellow leaders. Everybody's signing these pledges these days, and whether it's the PricewaterhouseCoopers CEO for Action or whether there's regional pledges.
Right.
How do you? And this is, I want you to talk to your fellow C-suite execs. How do you move from awareness to action?
To action.
Yes.
When all these pledges started coming out nationally, locally, we take a look at them. And number one, and again, they've more recently came out. So we've been on this journey very deliberately for 10 years. Most of the time when these pledges come out, we're doing 75% of it already. So that makes it relatively easy. But what it does do is make you push the last 25%. And it makes you actually realize that you have to be very, very intentional about what you're doing.
I like that too.
You are not going to make it, whether it's success for yourself or a community pledge, unless you have an intentional plan to get it done with accountability and people know you're doing it. And when we stand up and do a pledge, it is a challenge to some degree to the rest of the industry, whether it's in healthcare, whether it's locally as one of the largest employers, one of the largest companies in the state, to say, we're doing this. Why can't everybody else do this? So it really puts us out there as a leader. Now, the other thing I recognize, particularly both nationally and locally, not everybody has the resources of Freighter Health.
Right.
We are a big organization, so we can afford, because it makes sense for us to do that. How do we use these pledges as opportunities to put ourselves out there and say, well, we have completed about 75% of this. Let's tell our story.
Right.
Let's tell our story in terms of how we were able to do that, and how do we share stories. We learned from other people to get to the position where we are.
Right.
How do we now share those successes and help people get over those next humps and be able to do that.
Okay, leaders out there, you've heard it from somebody that has to do everything that she has to do and still push the diversity, inclusion, and equity strategy. Kathy, we're going to keep our eye on you.
Okay.
I hope that you'll invite us back. We'd like to come back and get an update.
Absolutely.
And see how you're doing. There's no doubt in my mind you're going to have some additional great things to share, not only with the diversity and inclusion practitioners, but the greater Milwaukee metro area that you're proudly serving. So thank you.
Thank
We
you.
appreciate it.